Good afternoon to all. Thank you, my friend Mr. Ashok Tyagarajan, for giving a nice introduction. Before I get into my presentation, I would like to introduce you my ARMC team who is behind the success of this conference. Let me request all ARMC team members to come forward. Fawaz, he is the one. He is the marketing manager, senior marketing manager. He is the one who is the behind this show, and he is the one made this event as a successful event. His contribution is all ARMC members please come forward. Where is Fawaz? Fawaz Sititundo. All ARMC team members, please come forward. On the dais, come. Come. Let us give them a big round of applause. And the main man that was, he's just gone out, I believe. And he is missing. And all my guys, they are the center managers of various other units across, Kerala, as well as in Tamil Nadu and Karnataka. And my marketing executives are also there. All these guys, they made this event as possible. Congrats, guys. Thank you.
Not a single lady, why only? Next time, please make additions.
No. This is I make them to work for 24 hours. 24/7 if you work. Already my friend Ashok has told I have a lot of girlfriends. So then it will be a problem in my family. That is the reason all these guys are working with me. Good. Thank you, guys. Come. Hey, Vishnu. So with this brief note, let me get into my topic. Today I have been assigned to share my experience on emerging trends in hospital administration. Today since morning we are hearing so many talks on technology and maybe branding and whatnot. Even architectural part also we were hearing a talk. This architectural part as far as myself is concerned, that is most important thing, because and as I was mentioning it earlier, that is the one which will decide your profitability. Because if there is a saying, if something is wrong in the beginning itself, then everything may go wrong. If you are good in planning and if you are good in executing your project execution, you are halfway, you are through. And if you are halfway, so you are through to successfully run the hospital. So I feel that part is also you heard of. So today I will be just going through some slides. So right now I am the CEO of ARMC IV Fertility Center. I am the founder member of Prunus Healthcare Services and Mediterranean Services also. And as we all know, healthcare industry, and it is diagnostic, preventive, therapeutic and other services which includes the medical equipment and pharmaceutical manufacturers also in healthcare industry. And most of us may be aware, just to recapitulate, just I am sharing with you, it is growing in a tremendous phase. And as I was mentioning it to you earlier, and we should be fortunate enough, fortunate to be in this industry, because which is having a CAGR of around 16.5%. And the industry is expected to reach around $280 billion by 2020. So today since morning you are hearing about artificial intelligence, AI. So last year almost 50 technologies have been targeted, and these are all the driving forces for trendsetters. That is what I name it. These are all the driving forces for trendsetters. Technology. You heard of enough and more from Mr. Ananda Padmanabhan and Mr. Neelakannan. Just to name a few: mobile app, artificial intelligence, robotic surgery, navigation system and molecular diagnostics. All these things are to name a few. The technology is the one which is going to rule the future healthcare. And innovation. Even though technology plays a vital role, the innovation which is going to make all the difference, and of course for doing all these things you need a funding also. So let me briefly tell you, that is I am going to talk about TIF. That is technology, innovation and funding. Already technology has been addressed, I will not touch upon that much, and I will be more giving you a stress for 5-10 minutes on this innovation and little bit on funding also. And why do we need this TIF? That is technology, innovation and funding. Divide between urban and rural population. Still India is dominated by rural population, and growing need of geriatric population, that aging of the people, I think geriatric population, shift from communicable to non-communicable disease, that is lifestyle diseases. Now we heard of that hypertension, diabetes, cholesterol or whatnot, everything. And most of you might have read recently that I think that BP, that hypertension, that readings, that I think you might have read it in the newspapers. So still I think this is mainly lifestyle diseases which is going to rule the market. And pricing for services. Morning I think we were having a different deliberations on pricing for services. Of course, as far as India is going to be driven by middle class population, the pricing is going to play a major role. So still, as I mentioned here, recently I read it in some of the newspapers, and 31% of the population is being insured. Still I think we have to go for a long way. And 2004 I think that first standalone health insurance company, that is Star Health Insurance Company, that was established. And over these 13 years, I think 13-14 years, and this health insurance market in India, I think it has touched upon around 30%. That means 125 crore. Out of that, how many people are being insured? 30%, I think it is close to 40 crore only. Remaining 80 crore population, still it is unaddressed, and this is out-of-pocket expenses. So that is going to put a stress on healthcare. Let it be private or I think let it be government, that is going to put a stress on healthcare. And I think these are all the models which has been already discussed, and the revolution in care delivery is being driven by technology, that is eroding traditional models and empowering the individuals. Technological innovation coupled with an engaged consumer, which I think Mr. Anandabadmavan was explaining on that. Connectivity, new care and disease management modules, telemedicine, EHR, that is electronic health record, EMR, electronic medical record, and so many other things that I think you just said that these are all technology which already has been discussed. And just to have an idea, and earlier the surgeries we were doing like this, now I think we are in a robotic era, and I think these robotic surgeries are being conducted. And this is one of the mobile apps which we use. This is one of the mobile app which is being used for in IRMC IVF, through which I think we do the telemedicine also. And technology consultation. Morning I think Mrs. Rama madam, I think she was mentioning about I think value addition for the medical tourism patient, which we are really practicing on that. Because I think we do have a Skype consultation facility for I think our specialty is infertility. So obviously this is a long-term treatment. It is not an overnight treatment or 1 day or 2 day treatment. So the patients may need, I think the couples may need, I think they have to plan their schedule well in advance, and they may do some kind of medications before they reach here for that ICSI treatment. So for that we are using the technology, and I think it is really I think producing a good results for us. And this you might have seen, I think this is a bring multi-parameter monitor being this thing replaced by this tablet based application. And then I think, as I have mentioned you, these are all some of the things I think which I wanted to share with you regarding technology. Now let me get into the innovation. Innovation, as far as the innovation is concerned, you can have 10 types of innovation across the entire value chain. Starting from business model, I think I will have a more emphasis on business model. As I was telling you, your business model is right, you are successful. That's it. I can repeat, your business model is right, you are successful. So in the business model, most of us, as far as the healthcare industry, especially hospital sector is concerned, what we used to do is, okay fine, if you get a cardiology, one cardiologist, start cardiology department. If you get something, so you are not so sure what you want to do. And doing a multi-specialty hospital, it is good. But whether you have that kind of strength, weakness and opportunity strength, that's what analysis you have to do. Not only if somebody else is doing, you should not do it. So the business model is the one I think which is going to make all difference for you, and I think to be a successful venture. Then partnership. And I think as we all know, I think when we invest in any venture, it is good to have some kind of good, I think, lead brands as a partners, to have a technical know-how which will help you to, I think, achieve a break-even at the earliest. That will help you to have a sustainability of the project. Enabling the process, that is what I am trying to tell you. So I have mentioned some of the examples also. Enabling the process. One is electronic health record. If somebody was consulted with you, if it is being electronic health record, even the patient sits at yours also, I think it may be possible to offer him a consultation. So that is enabling the process. Robotic surgery, telemedicine. These are all the things, some of the examples which is enabling the process. Then the core process. Core process is, what is core process? OP consultation, surgery and procedure. These are all the core processes which we used to offer in hospitals. Then I think next one is service performance. Obviously, if you are able to enable the process, as I have mentioned to you earlier, this Skype consultation, it may be a simple tool, but I think it enables the process so that the patient is also happy, the performance of that XC treatment is also being, I think, improved. So this is how I think you can do some kind of innovation in all levels. That is the 10 types of innovation which is being practiced in the industry. Of course, service, channel, if you have, I think ours is a network. Again, I think infertility is coming to that. I think I have around 5 centers in Kerala, and maybe I think 1 in Tamil Nadu and 1 in Karnataka, and 2 in, I think, 2 satellite units in Middle East we do have. And what it does to the patient, it is really, I think, it's not scalability alone. It does some kind of justice to the patient. It does some kind of value addition to the patient. Patient can have an initial OP consultation at my Dubai clinic, and I think you have had a Jimmy Kamal. Would you like to have Jimmy Kamal one more? Everybody is sleepy. Okay, fine. Otherwise, I will make you to dance for Jimmy Kamal. See, earlier I think you had only, I think, visual impact was there. Now you have to dance. Ready? That's what I feel. Okay, good. So that's the channel. I think that's what I think channel. How do we deliver on that? Satellite clinic, OP center, network of hospital. I think you might have. I think one of the proven models. I think this is a network of centers which we do and operate. And Aravind system. I think some of you might have come across Aravind hospitals. They do have in small villages. They have some these vision centers. They call it as vision centers. If there is a 5,000 population, they do have one vision center. What is really mean? That I think it makes lot of difference. I think if as being an hospital administrator, you should always innovate. You should always innovate in service delivery. That is the one I think which will give you a edge over others, and you can score on that. And brand, I think Professor had I think detailed discussion on branding. That price. Lead specialties. See, if somebody, I think as I was there mentioning, I think somebody talks about MIMS, somebody talks about Baby Memorial, somebody talks about Maitra. What it means really, I think what is the specialties they offer, what kind of pricing they offer, what kind of target population they do that, what kind of specialties they practice, what kind of services they offer, what kind of nurses they have, what kind of reception they have, everything. It's set of values. It's nothing but, I think branding is nothing but set of values. So that is what I think you have to do. Then overall the customer experience. That is what I think now I think we are in an era where I think the patient may not be looked as a patient. Even in ARMC also, I think you might have noticed, I think in my promoter slide, Dr. Mukunjamedi's slide, and we call them as client. Because as he has mentioned in his slide, and because one of the partners will be always all right. Maybe one partner may be having some kind of, I think, medical treatment, I think they may require, but other partner will be always all right. So it is always good to give you a good customer experience, which is word of mouth. As far as the healthcare industry concerned, word of mouth, which is going to give you a phenomenal result on your EBITDA or whatever, whatnot. So the sustainability of the organization, it is all going to be depend on number of the patients what we get. So for that, this customer experience is very, very important. These are all the shift is happening in the model of, I think, these are some of the models which you are familiar with it. In 2000, during 2000s, we were focusing on multi-specialty hospital. In 2000, between 2010, single specialty, clinical labs, retail medicine, pharmacies, and all those things. See, recently, I think last month, I think I was hearing a lecture of Mr. Velmani of Thyrocare. I think he was talking about something. I think he has started his career with 500 rupees, and he has reached a level of 3,700 crore worth of asset he has. What he did. He was focusing on thyroid. He was focusing on thyroid. So he has developed a brand on Thyrocare. And what was his investment, initial investment? Now the company is worth around 3,700 crores. That's what he claims. So that means that I think you have n number of opportunities. So the business model, that is what I am really emphasizing on it. The business model should be very clear. See, even I think if you take, I think if you give me to talk on business model, I can talk for days together. But I think I don't want to take much of your time. And even the same in ophthalmology, Vasan business model is different. Aravind business model is different. So that we have to study on all those things. And now I think in 2015-20, now home care, extended services, this Portia, Medicare, so many brands are coming up. They are all using technology, that you have to remember. They are all using technology, which is enabling the process. There only they are scoring. And care extenders, wellness and prevention and obesity. And of course, as I was mentioning to you earlier, this lifestyle disease which is ruling the market. And that will be, I think obesity is one of the main factors for it. And as I was mentioning it to you earlier, the business model, these are all the 5 components. Patient. Earlier I explained to you, who is your patient? Let it be socioeconomic status or specialty wise, who is going to be your patient? Process through which you are going to deliver it. Price. that whether the pricing is affordable. In a particular place, I think if you want to offer OP consultation for 1,000 rupees, if you want to get only 10 patient, you have to be priced in such a way. If you want 100 patient, and then you have to price it should be 50 rupees in India or 100 rupees in India, whatever it may be. That pricing, that is going to make you a difference. And of course the people, whatever may be your price, whatever may be your infrastructure, whatever may be your process, if your people are not good, that is starting from reception, doctors, everybody, if your people are not good, then you may not be in a position to make the profit in your organization. And these are also some of the successful models which I wanted to share with you. And all these common features of all these models is innovation in service delivery, structuring of project cost. That is what I have told you, the role of architect and an administrator in the phase of planning itself is very, very important. It should be patient-centric and affordable to the target population, scalable and profitability. Scalability and profitability are two sides of the single coin. And value for all stakeholders, process and technology integration, branding and ensuring quality. Regulatory reform is emerging as all populations demand quality health care. I think morning also you heard about quality, and of course even now I think in the evening session also we are going to hear about quality initiatives in hospital, that every patient is demanding for quality care. These are all some of the recent investment which has occurred in the space of healthcare. That is, I think Mr. Neelakannan and Ashok Tyagarajan, they are part of KIMS, and recently I think somewhere around 200 billion US dollars, and they have got from I think some True North company, that is I think maybe 12 to 18 months back, and there was another investment, and this is another investment, Dubai based company I think which has made in 1,500 crore investment. Then Procto Technologies, this is another technology. What they do is they do give I think specialty based software for the individual doctors. They also got a huge funding. So many fundings are ThyroCare, yes. The ThyroCare Technologies, I think a diagnostic laboratory chains that has I think target revenue of 1,000 crores by 2020. That is what they claim. And these are all, I think, investment. That's what I am trying to emphasize on that. Hereafter, I think healthcare, the investment is not an issue. If you have the right model, the investments will automatically come. And profitability is also not an issue in India if you are able to execute it properly. The issue is, I think we need good administrators to execute it. This is the shift is happening in healthcare delivery, and one size fits all. I think one size fits all, it will not be suitable for everybody, and so that is changing. The personalized medicine, that everybody is going to focus on the personalized medicine, and maybe I think curative to prevention. That is what I think it is going to be the trend, and let us focus on that. And this personalized, predictive, preventive and participatory, this kind of I would like to have this thing, recapitulate all these things. This is what I think the secret to great health, this is one of the ads, but I think it is good to share with you. Choose your Apollo personalized health check. This is DNA, data genetics, the DNA check they do. And this I think, you see, each patient is different. They have it is personalized, I think, medicine and personalized care plan to be delivered for each patient. For that, the technology is very, very important. That is what I think Mr. Neelakannan in the morning he was emphasizing on it. That is what artificial intelligence. A new personalized approach for diabetes patient. I think you see that HbA1c level. So if you have 6.5 HbA1c, oh, I am a diabetic. No, it is not so. And the lifestyle modification, that I think each patient, I think it has to be assessed. The doctor has to spend enough and more time with the patient to understand the needs of the patient. I think as we all know, understanding the need of the patient is the first level in the business. So I think we have to have a personalized plan for any patient. And these are all some of the recent developments. And with respect to infertility, if you say, I think earlier we were doing ICSI, IVF and all those procedures. What right now we are doing is this PGD and PGS. This is another latest, I think, development, which gives you, I think, if you quickly go through that, the goal of PGD is to identify abnormal embryos so they will not be transferred, leaving the unaffected embryos to be selected for transfer that are more likely to make healthy and disease-free babies. Down syndrome, if the babies are born with Down syndrome, then I think it will be a big mess. And if you are able to apply this PGD or PGS, then I think it will make a lot of sense. What does this new healthcare world look like? Increased collaboration. If you look at my earlier slides, that I think this business model and partnership, the collaboration which is going to give you the technical know-how that will help you to go for a long way. Better financial management, tighter cost constraints. I think we were discussing on so many other factors, that better financial management. Communication and content. I think you communicate with your patient in each and every level. That is going to be, I think, a need of the hour. And track and document outcomes. Pay for performance. pay for performance. Already the insurance companies have started, and most likely I think I worked in Dubai also for some time. During that time I think it is a different scenario to handle with insurance companies there. That is slowly emerging into India also. This is going to be there. Let me conclude like this. I think Mr. Nilakannan has also started with A, and I will also tell you that is 3A. That is accuracy. You can name it as quality, accessibility, affordability. These are all these three set of values, and this is called branding and business conversion. That gives you business conversion, and if your business is good, your EBITDA is good. If your EBITDA is good, you are sustainable in the market. Of course, then you are successful. For that, what we need? All sleeping leaders of healthcare. Is it? Post lunch. Very heavy? So how many of you want to be a CEOs of healthcare institutions? It is very tough. So as soon as I told tough, I think everybody has put their hand. Anyway, it is good. So we need leaders like you. You are all future leaders, and the healthcare is going to be with you. Thank you. All the best.
I request Ms. Rama Venugopal to come and hand over the memento to Mr. Krishnakumar, please.